Hi everybody, this is Dr. Louis Maltzmacher, the president of the American Academy of Facial Aesthetics, the AAFE, and we are going to show you our live demo of the AAFE techniques for solid filler PDO threads, and we're at a live patient training course, and we're going to get started with a live demo right now, so I'm going to take you over there right now.
Now, the smooth threads that we have, help me out, guys. What is it?
29 by 30?
29 by 30,
yeah.
29 by 40, and then
31 by 30.
31 by 30. So for lips, I tend to use a lot of the 29 by 30s when we're doing vermilion border. When you're doing hashtags, I have found like you could do any of those sizes.
What a hashtag?
Hashtag is like,
The
like
pound,
the lattice.
The pound sign.
The lattice.
That's for the acne scars, you said?
Yeah, for acne scars, if we're working in an area for like fine lines and texture lines, you would do a hashtag or a lattice, whatever we want to call it.
And you can do it for cheek enhancements. I mean, you can
Yeah.
add a bunch in the cheeks.
Right.
These guys do it to themselves all the time. You wouldn't believe what goes on here.
If you follow us on Facebook, you probably saw some of those videos. We're trying them in all kinds of fun places to see what they do for skin tightening. Anywhere where we can build collagen is a good thing. All right, so I think she's nice and clean. All right, just dry this off. So
Did he
now,
go get your threads? Are threads
Kimmel
coming?
was going to that. Yeah, he's getting on. So I'm gonna go ahead and draw on her. And for demonstration purposes today, go ahead and sit up again. Yeah. Okay. So I'm gonna, yeah, perfect. So my thumb, so think about that lateral canthus about a thumb or a centimeter out, and I hit where that orbital rim is. I kind of go right outside of that right here. So that's gonna be my entry point. And then I'm gonna do one thread to the mid-nasolabial fold right there. Sorry. So that's gonna be that one. And then I'm gonna try to help this jowl out more, so I'm going to use that same entry point, come down the jowl. So you wanna hit the tip of the jowl, and it's gonna go almost right under that mandible. And so you can get as much lift off of that as you can. And then the angle of the mandible, since these threads are a touch short and I want to make sure I get right past the jowl, I'm going to make the thread come right here, right to that edge, so I can at least catch most of that jowl and pull back. So then you could always use your finger and kind of play on those vectors and see what kind of lift am I going to get. So I told Diane, I'm like, I don't have to do 14 threads on you today because it's a lot of pressure sometimes for the model. So we decided we're going to do 3 on each side, and then, you know, if she's like, I'm okay to do more, we'll see. But this is a really good start, and you can always have the patient, if you want to start with just the minimum and then see how it feels and come back for more. There is nothing wrong with that. I'm going to lift here, see what kind of pull I'm going to get.
Is there a certain rule which one you do first?
You know,
I mean, it all depends on how you pull.
It really doesn't matter because in the end, they're all going to be in place. The most challenging one sometimes can be the jawline one.
What if they crisscross right at that point, intersection area?
You will sometimes run into that. You're not going to displace it. It's just going to go under or above it.
Okay.
Yeah.
You will feel it then?
You will feel it. I have felt it where like I can tell where I can feel my other thread and it can go right under it. Yeah. Good question.
twisted up. There's a little
Yeah.
line going up.
like that.
Yeah. So how do you take care of
So
that?
she's got thinner skin,
Uh-huh.
and so what we could do is, if we wanted, we could
Another
do,
one in there?
yeah,
Okay.
so we could put one here, and I would probably wait if I needed to use this one. This is a trickier area, we have
Mhm.
more vasculature.
Sure.
But what I would think about is, once I pull this in and pull this,
We'll take a look at it.
let's see how it lays, yeah. And then if we have to, we can always add another to help with more support, yeah. Okay. All right, so now Diane, you can lean back. I'm gonna have her all the way back.
So you just gave her in for orbital shots?
And mental.
Mental?
Yep, and now I'm gonna do lidocaine welts
Where are your
at my
attention point?
vectors, yeah. Okay, you're gonna turn. You want those away? Okay. You don't need that in your lap. Alright, so you're
Get
gonna
closer, you
turn.
guys can get closer.
All I'm gonna do is just add lidocaine first. Okay.
She's
Yeah,
gonna
don't
do
worry
the
about
same
it.
thing that she's doing on that side, she's gonna
Yeah.
do on this side,
Right,
okay?
right.
Okay, so what I'm gonna do is, I always pull up 2% lidocaine without epi into these ComfortTox 0.5 syringes. And from 0.5 to 0.25, I'm gonna use half of it in each one. So I usually pull up 2 if I'm gonna do 2 vectors. So half here and then half on this one. And this just makes that initial entry, a little poke here. You're gonna feel a little bit of a burn.
What percentage lidocaine is it?
2%? Yeah,
With no epi, right?
no epi.
Right. Same thing you'd use for trigger points for, I mean, you know.
And this just has to go right under the skin, make a nice little welt.
Do you ever do it without the blocks, with just the welts?
Yeah, yeah, I do.
Mhm.
It always depends on if the patient wants a block, what's their pain tolerance like, and if, as you're starting off and you're going slower, do the block.
Mhm.
It just makes everybody's life,
Yeah.
It's like when you started
Easier.
filler.
What about
Yeah.
the cream? And it's
well, this
topical.
is all deeper.
Deeper?
So this is
It
deep,
don't, it won't work.
right, you wanna have something that's gonna help more for deeper pain.
But the anesthesia is very patient dependent. I mean, we,
Mhm.
Yeah.
I mean, you have patients that tolerate this procedure very well.
Just like lips, you know, like some
Yeah.
people don't need any lidocaine cream or anything for lips, and other people need the whole shebang.
Valium, everything.
Right?
So which one are you?
She's got a good pain tolerance, but I told her, I'm like, I'm just gonna do this because there's a big crowd. You know, it just makes it that much less uncomfortable. Thank you. All right.
Take whatever I can get.
Yeah,
There you
yeah.
go.
She knows what the block feels like because we've done it before. We've done things around her lips. Okay, so you're gonna turn all the way. Yeah. Is your head comfy? Okay. All right. So I'm gonna start with the nasolabial fold one. It tends to be where I start. Just gives me a good feel of how things are going. So I'm just gonna make sure she's numb. Do you feel that?
No.
Okay. So I know these are sharp cannulas, but I still like to make my tunnel. So what I'm doing is I'm tenting the skin, and I'm just looking at where my subdermal plane is. So I've got my tunnel in that direction ready to go. It usually sometimes bleeds as soon as I take this out. So I usually just get a little gauze ready. Oh, she's good. These are 19 by 90, right? Okay. Okay. So we're gonna go into that tunnel. And here's my angle, right? A very shallow 5-degree angle. Now I'm in. I'm always looking at where my tip is. You can feel it right there. If you guys wanna feel, go ahead.
Definitely feel this. Feel
Don't
where her
touch
tip
my
is.
needle though,
Yeah.
okay? Okay. I'll let everyone feel another one too, okay? Okay. So I'm gonna use my left hand a lot for this. So I'm gonna push. See some of that buckling that wants to happen?
Mm-hmm.
There. So I can feel. Just pulling the skin over. Now I'm right here. I'm right
Feel
where I
that.
need to be.
Feel, and you guys
So-
should feel that.
Oh, I see. Oh my god.
Barbara, get in there and feel that, because this is a very, definitely a very touchy-feely kind of thing. You got to know where that tip is.
Okay. Okay. And then
So how deep are you? About 5 millimeters down?
it's hard to know.
Oh.
You know, it's really hard to know.
No, you're not. Yeah, it's really hard to
Yeah.
know.
And that's it. So as I,
Did you twist it?
you know, you don't have to twist on these.
Oh.
Smooth ones you do.
Smooth, yes.
Yes, smooth ones you do. So that's my, just gonna put a little pressure. There's my thread. So as I pull on it, you can kind of see the pull of the tissue.
Mm-hmm.
So I'm going to then use my same hole and go for this one. Okay. It's always good to look at your length too. Like, am I at a good length for what I drew? And I am.
Do you see a lot of that excess skin rippling up on the top?
You
With
if
the-
you're in the right plane, you shouldn't. Okay. So I felt that initial pop. Good. Breathe. Make sure you're breathing. This is always a tough one when we get to the mandible. Good, good, good. I'm right there, right where I need to be. You guys can feel it if you want.
Wow, you can feel that little pulse.
see it.
Mm-hmm. Okay. And I exaggerate with this hand a little bit as I pull it out.
So if the patients do develop bruising, is it mainly around the access point?
Correct. Well, sometimes, you know.
Hey, I hope you guys enjoyed that. That was fantastic. The patient already looks better because it really pulled up her skin. So she's going to be amazed when she actually gets up out of the chair. But we're going to now do the other side of the face. So you got to get trained if you do Botox and fillers. And if you don't, you got to come to the AAFE to get trained on Botox and fillers. But PDO threads are fantastic with the AAFE techniques, because I know a lot of you have gotten trained other places and it hasn't been as effective. You and the patients haven't been happy. Our patients are really happy because you got to get trained right. You got to have the right techniques to use these. But these solid filler PDO threads, the AAFE way is an amazing, amazing way to build your facial aesthetic practices, give patients what they want, and give them incredible, incredible results, because it's one more tool. It's everything together, and that's exactly what we teach. Hope you guys really liked it. It was a pleasure to be with you.